Welcome to this channel, where we provide educational content on medicine, pharmacy, and health to empower your learning and practice. Today, we're diving into another exciting topic in our Pharmacology Quiz Series, Anti-hypertensive drugs. This quiz will test your knowledge and reinforce your understanding of this critical pharmacological topic. Make sure to check out the companion video on this channel, which provides an overview of the main concepts of antihypertensives. The link to that video is available in the description below. Quiz instructions. This quiz will cover 10 multiple-choice scenario-based questions focused on antihypertensive drugs. The names of patients used in this quiz are fictional. Each question includes 5 options, of which only one is correct. After each question, we'll reveal the correct answer, provide an explanation for why it's correct, and explain why the other options are incorrect. This means that in this quiz, you'll learn 50 facts about antihypertensives in under 20 minutes. So, let's get started. Question 1. Mr. Johnson, a 65-year-old male with a 10-year history of hypertension, presents for a routine follow-up. He is currently on amlodipine 10 mg once daily. His blood pressure is well controlled at 130/80 mm mercury, but he complains of persistent ankle swelling over the past 3 months. He denies any chest pain or shortness of breath. Which of the following is the most appropriate step in managing his condition? Option A, add hydrochlorothiazide 25 mg once daily. Option B, reduce amlodipine to 5 mg once daily. Option C, switch amlodipine to lisinopril 10 mg once daily. Option D, start furosemide 40 mg once daily. Option E, continue current therapy and monitor. The correct answer is option C, switch amlodipine to lisinopril 10 mg once daily. The explanation is as follows. Amlodipine, a calcium channel blocker, commonly causes ankle swelling as a side effect due to peripheral vasodilation. Switching to lisinopril, an ACE inhibitor, addresses hypertension without causing fluid retention, making it a suitable alternative in this case. Here is the explanation for incorrect options. Option A is incorrect because adding a diuretic does not address the underlying cause of swelling caused by amlodipine. Option B is incorrect because reducing the dose may lower effectiveness for blood pressure control but may not fully resolve the swelling. Option D is incorrect because starting a loop diuretic like furosemide is unnecessary in the absence of fluid overload or heart failure. Option E is incorrect because monitoring alone fails to address the patient's distressing side effect. Question 2. Mr. Carter, a 64-year-old man with heart failure with reduced ejection fraction, HFrEF, and hypertension, is started on spironolactone. All of the following should be monitored regularly except Option A, serum potassium. Option B, renal function. Option C, liver enzymes. Option D, blood pressure. Option E, serum creatinine. The correct answer is option C, liver enzymes. The explanation is as follows. Spironolactone primarily affects renal function and potassium levels, so monitoring these is crucial. Liver enzymes do not typically require routine monitoring as spironolactone does not significantly impact hepatic metabolism in most patients. Here is the explanation for incorrect options. Option A is incorrect because spironolactone can cause hyperkalemia, necessitating regular potassium monitoring. Option B is incorrect because renal function must be monitored to prevent worsening kidney injury. Option D is incorrect because monitoring blood pressure ensures optimal therapeutic control in heart failure and hypertension. Option E is incorrect because spironolactone can affect renal function, making serum creatinine monitoring essential. Question 3. Mr. Brown, a 78-year-old male with hypertension and chronic kidney disease, CKD, presents for medication review. Which of the following antihypertensive agents should be avoided in this patient? Option A, lisinopril. Option B, atenolol. Option C, spironolactone. Option D, amlodipine. Option E, hydralazine. The correct answer is option C, spironolactone. The explanation is as follows: spironolactone, a potassium-sparing diuretic, increases the risk of hyperkalemia, which is particularly dangerous in patients with CKD. Avoiding this drug minimizes complications such as arrhythmias. Here is the explanation for incorrect options. Option A is incorrect because lisinopril is beneficial in CKD, reducing proteinuria and slowing disease progression. Option B is incorrect because atenolol is generally safe in CKD when used with dose adjustments. Option D is incorrect because amlodipine effectively controls hypertension without significantly affecting renal function or potassium. Option E is incorrect because hydralazine is safe and commonly used in CKD patients for blood pressure control. Question 4. Ms. Clark, a 50-year-old woman, is prescribed verapamil for hypertension. She reports severe constipation after starting the medication. Which of the following medications would be an appropriate alternative? Option A, diltiazem. Option B, amlodipine. Option C, metoprolol. Option D, clonidine. Option E, hydrochlorothiazide. The correct answer is option B, amlodipine. The explanation is as follows: amlodipine, a dihydropyridine calcium channel blocker, effectively lowers blood pressure without causing significant constipation. It is an ideal alternative for patients intolerant to verapamil. Here is the explanation for incorrect options. Option A is incorrect because diltiazem, like verapamil, may also cause constipation. Option C is incorrect because metoprolol is less effective than amlodipine for primary blood pressure control. Option D is incorrect because clonidine has significant side effects, including sedation and rebound hypertension. Option E is incorrect because hydrochlorothiazide is not as effective as a first-line therapy in this scenario. Question 5. All of the following are correct regarding angiotensin-converting enzyme, ACE, inhibitors except Option A, they reduce proteinuria in diabetic nephropathy. Option B, they may cause a dry cough in some patients. Option C, they are safe for use in pregnancy. Option D, they are effective in managing heart failure. Option E, they may cause hyperkalemia. The correct answer is option C. They are safe for use in pregnancy. The explanation is as follows: ACE inhibitors are contraindicated in pregnancy because they can cause teratogenic effects, including fetal renal dysfunction and developmental abnormalities. This makes them unsafe during pregnancy. Here is the explanation for incorrect options. Option A is incorrect because ACE inhibitors effectively reduce proteinuria in diabetic nephropathy, protecting renal function. Option B is incorrect because a dry cough is a known side effect of ACE inhibitors due to bradykinin accumulation. Option D is incorrect because ACE inhibitors improve survival and symptoms in heart failure by reducing afterload. Option E is incorrect because ACE inhibitors may cause hyperkalemia by reducing aldosterone levels. Question 6. Mr. Davis, a 60-year-old man with uncontrolled hypertension, has been on hydrochlorothiazide 25 mg daily for 3 months with no improvement in blood pressure. His potassium is 3.0 millimoles per liter, normal, 3.5 to 5.0 millimoles per liter. Which of the following would be the most appropriate next step? Option A, increase hydrochlorothiazide dose. Option B, switch to furosemide. Option C, add lisinopril. Option D, add amlodipine. Option E, add spironolactone. The correct answer is option E. Add spironolactone. The explanation is as follows. Spironolactone is a potassium-sparing diuretic that addresses both hypertension and hypokalemia, making it an ideal choice in this scenario. It counteracts the potassium loss caused by hydrochlorothiazide while also providing additional blood pressure-lowering benefits. Here is the explanation for incorrect options. Option A is incorrect because increasing the dose of hydrochlorothiazide could worsen hypokalemia without significantly improving blood pressure. Option B is incorrect because furosemide is more commonly used for volume overload than for primary hypertension, and it can exacerbate hypokalemia. Option C is incorrect because lisinopril may worsen hypokalemia if potassium is already low, increasing the risk of adverse effects. Option D is incorrect because amlodipine, while effective for hypertension, does not address hypokalemia. Question 7. Mr. Anderson, a 58-year-old man with a history of type 2 diabetes and hyperlipidemia, presents to the clinic with uncontrolled hypertension. His current medications include metformin 1g twice daily, atorvastatin 40 mg daily, and lisinopril 20 mg daily. His blood pressure today is 162/98 mm mercury. The physician decides to add a diuretic to his regimen. Which of the following is the most appropriate choice for this patient? Option A, hydrochlorothiazide. Option B, furosemide. Option C, spironolactone. Option D, amiloride. Option E, mannitol. The correct answer is option A, a hydrochlorothiazide. The explanation is as follows. Hydrochlorothiazide is a thiazide diuretic that is commonly added as a first-line option for hypertension when additional control is needed. It is particularly effective in managing hypertension in patients with diabetes when combined with ACE inhibitors like lisinopril. Here is the explanation for incorrect options. Option B is incorrect because furosemide is typically reserved for volume overload or heart failure, not routine hypertension. Option C is incorrect because spironolactone is more appropriate for resistant hypertension or patients with primary hyperaldosteronism. Option D is incorrect because amiloride is a potassium-sparing diuretic, which is not the first-line choice in this case. Option E is incorrect because mannitol is an osmotic diuretic, used primarily for cerebral edema or acute renal failure, not hypertension. Question 8. Mr. Johnson, a 35-year-old man with no significant medical history, presents with a hypertensive emergency and a blood pressure of 210/120 mm mercury associated with chest pain and shortness of breath. Which of the following drugs is most suitable for immediate blood pressure control in this patient? Option A, labetalol. Option B, amlodipine. Option C, enalapril. Option D, spironolactone. Option E, losartan. The correct answer is option A, labetalol. The explanation is as follows. Labetalol is a combined alpha and beta blocker that is effective for rapidly lowering blood pressure in hypertensive emergencies. Its ability to provide rapid control without significant reflex tachycardia makes it a preferred choice in acute situations. Here is the explanation for incorrect options. Option B is incorrect because amlodipine works too slowly for hypertensive emergencies. Option C is incorrect because enalapril is not recommended for immediate blood pressure control in emergencies. Option D is incorrect because spironolactone is not appropriate for acute hypertensive management. Option E is incorrect because losartan is primarily used for chronic hypertension and is not suitable for emergencies. Question 9. Ms. Miller, a 65-year-old woman with chronic kidney disease, eGFR 25 ml per minute, and hypertension, is being evaluated for medication adjustment. All the following antihypertensives are appropriate for this patient except Option A, lisinopril. Option B, losartan. Option C, diltiazem. Option D, hydrochlorothiazide. Option E, amlodipine. But correct answer is option D, hydrochlorothiazide. The explanation is as follows. Thiazide diuretics like hydrochlorothiazide are generally less effective in patients with significant renal impairment, eGFR less than 30 ml per minute, and may lead to electrolyte imbalances. Here is the explanation for incorrect options. Option A is incorrect because lisinopril is suitable for hypertension in CKD and slows disease progression. Option B is incorrect because losartan is effective for blood pressure control and offers renoprotective effects. Option C is incorrect because diltiazem can be used safely for hypertension in CKD. Option E is incorrect because amlodipine is effective and does not adversely affect kidney function. Question 10. Ms. Jackson, a 32-year-old woman who is 10 weeks pregnant, is diagnosed with gestational hypertension. Her blood pressure is 145/92 mm mercury. Which of the following is the safest antihypertensive option for her? Option A, lisinopril. Option B, methyldopa. Option C, atenolol. Option D, amlodipine. Option E, losartan. The correct answer is option B, methyldopa. The explanation is as follows. Methyldopa is the first-line antihypertensive medication for managing gestational hypertension due to its established safety profile during pregnancy. It effectively reduces blood pressure without adverse effects on the fetus. Here is the explanation for incorrect options. Option A is incorrect because lisinopril is contraindicated in pregnancy due to teratogenic effects. Option C is incorrect because atenolol is associated with fetal growth restriction. Option D is incorrect because amlodipine is less preferred due to limited safety data in pregnancy. Option E is incorrect because losartan is contraindicated in pregnancy due to teratogenic risks. Conclusion. That wraps up our revision on antihypertensives. I hope you found this quiz session engaging and informative. To deepen your knowledge further, consider reading resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. These references will solidify your understanding and enhance your preparation. Also take note that in this video, any mention of guidelines will specifically refer to those outlined in the BNF. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.